My name is Fanie Hendriksz. I'm the Managing Director of ePharmacy. I'm a qualified pharmacist. I've been in the healthcare industry for 20 years, specializing in pharmacy and pharmaceuticals. ePharmacy is a last mile dispensing and distribution solution. We focus on innovation to make a positive impact on the public healthcare system. The benefits of our technology has allowed for improved access and availability of pharmaceutical services to the public sector, and with a patient-centric approach for positive healthcare outcomes. The definition of last mile for us is where a healthcare facility receives bulk drug, and from there on it gets complicated, and that's where we're starting to play a role. So last mile is literally the dispensing, distribution and successful adherence of medicine by patients. So in essence, to get the medicine to the patient. Smart lockers as a concept has originated in Europe, where it's actually online collection point for online ordering or e-commerce. It's adapted worldwide and made obviously famous by Amazon. The reason why it's so well accepted into the market is the fact that it's a lot of convenience for customers. So it's in essence, it's pickup points for people that order their stuff online, or let's say commodities or electronics, etc. So you'll be able to collect any order that you've done online at a place or a locker which is conveniently situated for you. You know, we're all busy with our work, we're all busy with our day-to-day, and these lockers are in line with our daily movements, and you can select a locker that's convenient for you to pick up your goods. Obviously, the South African healthcare setting is overburdened as we speak, especially in the public health sector. We also currently see patients queuing at private sector pharmacies. So currently there's a program in South Africa called the CCMDD program, where in essence we're decanting patients from overburdened facilities to collect pre-dispensed parcels. We've analyzed this technology, and it's perfect for patients to pick up their parcels at Collect and Go smart lockers, just purely on the convenience of it, and then also assisting the National Department of Health in decanting their patients. Currently, the Collect and Go smart lockers is 100% South African manufactured. We initially started with production in the East, but when we saw the opportunity to move manufacturing to South Africa, we collaborated with CSIR, and now all our lockers are 100% locally manufactured. So the positive benefits of local manufacturing is obviously it resulted in a lot of jobs that's been created. The collaboration with CSIR was also a platform that will be utilized going forward. And it also resulted in us collaborating with Amazon Web Services that's based in Cape Town for further scale of this technology. Firstly, we need to mention the fact that, you know, to minimize contact with each other, alternative pickup points is quite needed, because the normal public health sector needs to continue where people receive their medication. An additional benefit is also that we minimize the risk of co-infection when you start decanting patients. So we need to support patients in not traveling long distances with taxis to obviously minimize the risk of co-infection. In a crisis like this, I do think we need to be mindful that our facilities are already overburdened, and we need to actually decant them to make way for much more urgent and emergency patients. Our current role is to firstly still focus 100% on our current and existing patients to keep them adherent, and it's important that over this time that they have access and availability to the chronic medication as normal. The beauty of the technology is the fact that we can add condition-specific programs to it for distribution as needed by the National Department of Health. So the ATM pharmacy is a South African innovation. In essence, it's an ATM that everybody knows where you get cash. There's a big difference between an ATM pharmacy and a vending solution. What makes the technology very cool is the fact that the patient is in a direct link with a call center, which we call telepharmacy, where a pharmacist face-to-face can, via audio-video link, can discuss conditions with the patient, he can add items to the prescription, he can subtract items. So it's a real-time dispensing point at the point of care. We've seen a rapid increase in our patient numbers. Obviously for us it's a positive thing because it gives the patient an opportunity to collect at an alternative pickup point when it matters most. The beauty of it is you know, we've got capacity at these sites. Because it's such a patient-centric solution, we've seen patients collecting their chronic medication 2 months supply in under 3 minutes. I think what COVID-19 has showed us that, you know, we need to fast-track the decanting of facilities for obvious reasons. Firstly, to assist the public healthcare system, but also to make it more convenient for patients to collect their medication. I think in a crisis time like this, it's important that your staff know that you're with them in the trenches. So it's more that you actually collaborate with them to achieve better healthcare outcomes for our patients. So it's all about a positive attitude, a positive mind, and collaboration with your staff to make it happen. I think COVID has shown us that we need to celebrate innovations and collaborations. I think without innovation and collaborations, we cannot advance healthcare as it is. So the benefits of our technology is firstly, ultimately improving access and availability of medicine. There's additional benefits like convenience, it's scalable, it's economical, but I do think the access and availability that it provides to patients is the main thing. We are only using 15% of our capacity currently. So our plea is for healthcare workers and the public healthcare system to assist us in decanting patients to fill this void. ePharmacy currently has 2 CDU projects. So in essence, a CDU is a central dispensing unit where we're assisting government to decant patients for stable and unstable patients. Currently, we've got a CDU in Ndola in Zambia, in the Ndola district, and also in Mangaung in the Free State. ePharmacy was also pioneering the first 3 in-pharmacy automation programs in South Africa, where we utilized automation robotics to automate dispensaries in public hospitals. We've automated Steve Biko Academic Hospital, Helen Joseph Hospital, and then Thembaletu Clinic. Since inception, ePharmacy has serviced over 2 million patients in pharmacy automation at these 3 facilities. Since the announcement of the COVID lockdown in South Africa, we've seen a massive increase in patient numbers at these facilities. If it wasn't for automation, the staff wouldn't be able to cope with the high patient numbers. And what we've seen now is a 55% increase in patient numbers with the same amount of staff. It's early days in COVID-19, and what we've seen with the technology, it's scalable, it creates capacity and a much higher throughput for patients. So we've already seen an increase in inquiries regarding our technology, and we expect that the days after COVID will allow people to take innovations into the public health system for better healthcare outcomes.